In other words, those not medically necessary. And there's no reason, colleagues, for us to do this when we could have a bipartisan bill that nearly everyone in this chamber could support. And that's what we've done most of the session on controversial bills. So I wanted to make sure that we had the opportunity to do that one more time. And I know that people have their positions on abortion and that they're heartfelt, just like mine is. And I want to affirm life at every level. I've talked about that before. Because how we treat the most vulnerable says a lot about who we are. So whether you're young and vulnerable, or whether you're old and vulnerable, your life still means something. Your life means something Your life means something if you have a disability. Yet we're so quick to say, well, they have this malady or they have that malady. The one that comes to mind the most is Down syndrome. Would we look at a precious child who's born with Down syndrome, who's living today, and say, your life isn't worth anything. You should or could have been aborted. Would have made things easier. Really? Doesn't seem like compassion to me. We all have something wrong with us. It's just a matter of degrees, because nobody's perfect. And at some point, we're all going to have something wrong with us, and we're all going to be vulnerable. And that's why life is so important. We pursue a culture of death in this country, and it's pervasive. It's everywhere. It's in our movies, it's in our TV shows, it's in our video games, it's in our magazines. It's down the street. And what we're trying to do is affirm a culture of life. There's a lot of good reasons, colleagues, to have a bipartisan bill. The souls of 50 million babies in our country cry out for justice. And I know God hears them. The question is, colleagues, will we hear their cries for justice and truly make this a bipartisan bill about women's health? Or will we simply be about forcing good people to fund what kills their souls? Colleagues, I urge your aye vote on this amendment to make it a bipartisan bill. Thank you.